So now we want to bring in pediatrician Dr. Dyan Hes. Doctor, we've talked to you a number of times throughout this pandemic. Before I get into some of the latest things that we've learned about the coronavirus, I want to ask you what you are hoping to hear from these healthcare experts as they testify in front of Congress. You know, at times we've watched Dr. Fauci, and it's been a little awkward for him. You can sort of see him trying to very expertly pick the right words to thread the needle, but sort of between what the president is saying and the message that he wants to get out to the public. We haven't heard from him a lot lately, at least not at any of these briefings. So what are you hoping to hear from him today?
I'm hoping to hear what is the plan to protect physicians who are working on the front lines. And I think in the plan, you have to consider people like myself who are in private practice, family practice, who have no access to protective equipment. So when the president says we are testing everybody, he can give me a call, because I can tell you that I'm in New York City. We have about 40 gowns left, and that has to last me forever. I cannot get gowns from Henry Schein. I cannot get gowns from DealMed. While we were waiting, I just got a text message from an importer begging. I begged him to buy gowns. He said, "You are too small. We can only sell gowns in the millions." So how can I test people if I have no protective gear? I have to send my patients. Every patient that had a fever this week, we have had to call 10 to 20 urgent cares. I have to have a patient who has a car who could drive out to Long Island or Staten Island or somewhere else to get tested. Because in New York City, most private pediatricians do not have any gear to test, because we will expose everybody in our office. So how are we going to make it to September? How am I going to work? How are we going to stay open?
Dr. Hes, it's heartbreaking to hear you make this point, because I think it's hard for people to hear the mixed messaging that we sometimes get from the White House about how this enemy, this unseen enemy, is being vanquished, how everybody who wants a test can have a test, which we know is simply not true. And then we actually hear from doctors like yourself who say, not only is it not true, we don't even have the protective gear that we need to be able to do our jobs. And yet, even as we are doing a little bit better right here in New York City, the danger, as Governor Cuomo has pointed out, is that people are lulled into a false sense of complacency, because the numbers are slightly down here in the city. There are parts of upstate New York that will be reopening. But when I hear medical professionals like yourself express the frustration that they have right now, it just reinforces in my own mind that we have a long way to go. And I'm guessing that is essentially the message you're conveying here.
Yeah, we are desperate. We have so many children that have to be caught up on vaccinations, parents who are terrified to leave their house. We call, we beg. We're starting to do home visits this week. It took me 2 weeks to get a portable scale. I have portable sharps container, and we're going to start doing home visits, because we're going to have massive outbreaks of other vaccine preventable diseases. I mean, the whole thing is a domino effect and a ripple effect. And I am really anxious, and I'm not an anxious person, but I'm really anxious how doctors are going to be able to stay open unless they're affiliated with a hospital. I don't know where the supply chain is coming from. Are we going to have enough gloves? Are we going to have masks? Are we going to have face shields? I mean, we haven't hit September when flu season starts. So we're going to have a whole nother set of infections. And, you know, when people are looking at the numbers that the kids have less when they're studying them now, these articles that came out in the New York Times, and the kids, they might have the virus, but they're less infected than adults. Well, of course, we're in quarantine. Who's going out and doing the food shopping? Who's going out and going to the pharmacy? The adults, not the kids. The kids are staying home. But once you're going to let these kids back out, they're going to get infected, and they're going to be asymptomatic. And that's what we're seeing now. And that's what I've been saying all along. And I'm sorry I'm a little bit passionate about it, but it's so frustrated.
No, Dr. Hes, I think that you make a great point, and it's a really good reminder to people that when we initially started talking about tests, you know, throughout a number of the states and the health departments, they were saying, well, you know, the test has multiple components, and we can't do a test unless we have the right swabs or unless we have, you know, something else. And what you're also pointing out is you can have stacks and stacks of these tests in a warehouse ready to be distributed, but there are other things that are necessary to conduct the tests. And, we've also heard that, just a one-off test really isn't good enough. People should be tested, at least another time. And so, you can't say that we are successfully testing people unless everyone has access to the test, and then all of the gear that makes it safe to do the test, and then the ability to get those results in a timely manner. All of this is necessary. But listen, doctor, I don't want to run out of time because I want to get some of this, get this conversation in about kids and the coronavirus. And, you talked about, children and the inability to test them. We've had this sense for a long time that kids really weren't that susceptible, that if they got it, they wouldn't really get sick. But now we're seeing all kinds of other things pop up in coordination with the coronavirus in children. Tell me what you're concerned about and what we've been seeing happening in Spain, because we have now countries that are ahead of us in this process. What about children in Spain? What are we seeing that we could learn from?
Oh, I have to be honest, I don't remember that article. I glanced at it this morning, but I don't remember if it, I think the numbers started to go up again. Was that the article? They opened and they opened the school, and the numbers started going up. Because they say, other studies from Wuhan say that like children who go back out into the community have 3 times as many contacts as adults because they take the bus to school, they take transportation, they see their teachers. So, I mean, this is what we're worried about, opening early again and exposing children who are going to come home. So they might not be sick, but they're going to expose it to their grandparents or aunts and uncles, their parents. The whole, it's funny because my husband's in finance. So he always says, we need the country to reopen somewhat because there's going to be many more deaths of suicide when people do not have jobs to pay their bills and to feed their children. So, is it death from depression, suicide? Is it starvation, which I hope would never happen? But there are so many side effects of not reopening the country, which I understand, but we have to do it in a safe manner. And what we've learned is that, in New Jersey, they tried to open the parks this weekend and they closed them the same day because it was too crowded and people weren't wearing face masks. So if we have a country of people who are not going to follow the laws, it's just going to be a vicious cycle, and this is going to go on forever.
Yeah.
Yeah, and Dr. Hes, is something that the president has pointed out. He pointed it out yesterday that the risk, of course, is, as you say, for people who do not have jobs, who don't have income. There are other maladies that they could be afflicted with, including drug abuse and worse. The question, though, with children is an interesting one because there have been some from the White House, including the president and governors, who have talked about potentially reopening schools, and yet it seems as if we are not very clear on how COVID-19 affects children yet. We're not very clear on how they potentially could spread COVID-19 if they're asymptomatic. And I want to ask you about the children in New York who have died from this mysterious inflammatory syndrome that is possibly linked to the coronavirus. 2 more deaths are under investigation. What have we learned about this illness since it was first discovered in children in the UK? And what does it bode for the potential of children being back in school or back in the population where they might be exposed to adults or people who have comorbidities?
So what I've been saying, and we've been talking for weeks, is that I think that many of our children had COVID in the winter. Like I've said many times, we had the sickest winter, January and February. I never call an ambulance to my office. We had at least 10 ambulances called within 2 months. And our patients did not have flu and they did not have RSV, the most common ones. But there's other viruses, but they did not have them. We didn't know what was wrong with them. I think that most of our children were probably exposed in crowded communities like Chicago, New York, New Orleans, Detroit, where it's getting hit the most. I think that they weren't so sick because luckily COVID really isn't that dangerous in children. But now the Kawasaki-like inflammatory syndrome is what we're seeing, is that they were asymptomatic. The parents, most of these parents with the kids who have these cases didn't know that their children had COVID. Not all of them have tested positive, but most have or have antibodies. So the families didn't even know. My worry is that how did they get so sick? Did they not come to the hospital because they're afraid to go to hospitals? Their child might have had fever for 5 days, was not looking well. But I think right now, so many people are afraid to go to a hospital that they might be waiting too long to get there, because we've talked about your daughter before that she had Kawasaki's. It is a treatable condition, but you have to catch it in time. And if you're terrified to go to a hospital, you're not going to catch it in time.
Yeah, Dr. Hess, that is a absolutely great point. Really appreciate you spending time talking to us. Appreciate your passion. Thank you so much.
Thank you.